Good afternoon. This is Kimberly Shirk with Talent Plus, and we're so excited that you've joined us today. Thank you for taking the time to come to Hospitality, when two industries collide. We have two of our own associates here today, Larry Sternberg, President of Talent Plus and former Ritz-Carlton General Manager, and Paul Marsolek, Patient Experience Expert and Talent Plus Consultant, joining us today. Let me tell you a little bit about these two presenters, just to give you a little background before we get started. When organizations seek to create breakthroughs, they turn to Talent Plus President Larry Sternberg. He is one of the most innovative thinkers in the field of human resources today. Prior to joining Talent Plus in 1999, Larry utilized the science of talent in his roles as Vice President of Human Resources with the Portman Hotel Company and as a General Manager at the Ritz-Carlton Hotel Company. He is a native of upstate New York, and he holds a Bachelor of Arts degree in philosophy from Hamilton College, as well as a Juris Doctorate from Georgetown University Law Center. Paul Marsolek joined Talent Plus as a client lead. His primary role is as a trusted advisor and consultant to clients, primarily within the healthcare industry. Prior to joining Talent Plus, Paul held the position of Director of Loyalty and Engagement for Health Management Associates, in which he was charged with executing a turnaround in performance in patient satisfaction, as well as employee and physician engagement. Paul holds a bachelor's degree in manufacturing engineering from the University of Wisconsin. Just a couple of housekeeping items. We want to make sure that everyone has muted their phones. That will ensure great sound quality for them, or for us as well. And as we go through this webinar, we just invite you to participate. This is a conversation, so we would love to hear from you. If you have questions throughout our time, we encourage you to type them right into your screen, and we will be addressing those as we go through the presentation. We do want to let you all know that you will receive an email with a link to this podcast at the end, and you can feel free to share that with anyone that you would like. And without further ado, Larry and Paul, thank you so much for joining us today.
Great to be here. Thank you, Kim.
Yes, it's great to be here. So why are we here today? We're here because these two industries have a lot in common. They experience very similar challenges. First of all, they're very labor intensive, and getting the staffing right is extremely important. You're either going to understaff and not deliver the kind of service you want to deliver, or you're going to overstaff and run up your costs, which doesn't help any of the constituents you're serving. Both industries are subject to uncontrollable variables that occur every single day. So you show up in these industries and you really don't know what your day is going to be like. People have to be very resourceful. You're running several businesses under one roof. You're running maintenance. You're running housekeeping. You have a food and beverage operation. There's a restaurant. Both industries have room service where the tables are very far away from the kitchen. Both are 24/7 businesses. You're worried about occupancy in hotels, and you're worried about census in healthcare. Both industries are high-touch and frequent-touch organizations where caring about the patients and about the guests is critical. Both industries, you're worrying about your reputation for quality and service. So what we hope to learn today is best practices that each industry can benchmark against the other to improve the outcomes they are delivering to all of their stakeholders. Paul?
Interestingly, Larry, you mentioned reputation, and reputation is really what we have. It's what brings people to us. Our patients come to us because of our reputation in the hospitality business. Our guests come because of the reputation, and there's an intersection here that's really very interesting in between both hospitality and healthcare, and that's between ambulance drivers and taxi drivers. In the healthcare business, one of the things we do to improve reputation is we woo EMS drivers. We make it very convenient and very easy for them to practice, or very easy for them to deliver. Because when they have the opportunity to make a choice about where they're going to bring a patient, of course hospitals want to make sure that they understand that the patients that they have, or the patients that they're going to be providing care for, bringing to a hospital, are going to get the best patient care from that hospital specifically. And that's really very similar to what happens with taxi drivers in the hospitality business.
Yes, and although taxi drivers don't really decide where they're going to take a guest, the guest already knows what hotel they're going to, the taxi drivers do speak to the guests, and what they say about various hotels makes a big impression on the person in that taxi and sets them up for a mental set about that hotel. And so luxury hotels, when they open, typically woo the taxi drivers. In many cases, I provided boxed lunch for taxi drivers during the first week of opening to get them to see the hotel and to make a good impression on them.
About 20 years ago, hospitals began to realize that patient satisfaction is more than just the clinical outcomes. People had to feel good about their visit. There was an emotional connection to that experience. And the decor changed, the level of personalization changed, the outcomes, of course, continued to be high in terms of clinical outcomes, but the way people felt about their visit became equally important as well. So we're going to transition into talking about what healthcare can learn from hospitality right along those lines. And the first thing that we'd like to talk about is a warm welcome. Larry, tell us a little bit about what a warm welcome looks like and feels like in the hospitality business.
Well, the warm welcome repeats every time a guest encounters an employee in a different part of the hotel. It starts, of course, on the telephone when a guest calls the hotel. But I want to focus on the arrival at the hotel. And here you are with that taxi driver who has already said things about the hotel, good or bad. You arrive at the front door, and the standards that I'm used to in a luxury hotel is that the doorman needs to have his hand on that door handle before the car stops rolling. So immediately you pop those doors open and people feel like they're the Secretary of State from an important country arriving for an important visit.
Larry, one of the things that we talked about and that I want you to share with us is that connection you make between a warm welcome, total fulfillment, and the fond farewell. Tell us a little more about that.
In a former life, we used to call that the 3 steps of service, and I assure you, whether you're in the hospitality industry or whether you're in the healthcare industry, if you can get your employees to get this right, you'll go a long way to maximizing their experience, their good experience. So the warm welcome, you've got to be happy to see somebody. And if you can find out their name and you're using their name, and if they've been there before and you've learned their name, this is a very big deal. But you've got to be sincerely happy to see that person arrive. And then once they arrive, total fulfillment of their needs. The standard I'm used to is this: if it's moral and legal, do it. And if you can't figure out how to do it, talk to your supervisor. That's the proposition of a luxury hotel. And then finally, a fond farewell. This is going to maximize the satisfaction somebody has with the human part of the experience, the emotional part of the experience.
Those of us with a focus on healthcare can agree that a warm welcome would only strengthen our reputation, the relationship with our patients and guests and their family members. Recent analysis done here with one of our clients in an emergency department determined that the most powerful domain in the emergency department in raising scores was arrival. It was a warm welcome. And one of the questions is, those of you that are on the call that are aware of the measures that are done, is there's a question on that emergency department survey that says friendliness of the first person. And this is a defining factor. This is a way that we can actually measure ourselves or benchmark ourselves against how well we're doing with those clients. So thank you, Larry. You know, the next thing that I'd like to talk about and really understand more about from the hotel business and as a hotelier, tell us about anticipated spoken and unspoken needs.
Anticipating needs has been talked about in the hotel industry from time immemorial, and there are classes on how to anticipate the needs. But the truth is, if you don't have employees who have a high level of empathy and want to take action to take care of a customer, where they can read that guest, where they can read the situation. For instance, a couple on their honeymoon has very different needs than a business travel. Parents with children have a different set of needs than the other 2 kinds of guests I've spoken about. And they're going to arrive having had different travel experiences. And the best employees, both in healthcare and in hospitality, can read that guest across the room. Are they upset? Are they tired? And then figure out immediately, what can I do to address that need that I'm perceiving right now?
Interestingly enough, in healthcare, we see the same thing happen. And when we run analysis and do reporting, what we identify from time to time is that there are different responses based on different times of day, and also by gender in different ways. And one of the analysis we've done, which really goes around the anticipation and needs, is hospitals need to understand what hospitality does today in terms of different demographics. For instance, if a woman with a family shows up in the emergency department late into the evening or in the early morning hours, this is somebody that's probably very sick. If they weren't that sick, they would wait till morning to come in. And if they do, they might be coming in with the children. And if they do come in with the children, they have needs that we have to anticipate. Do we have diapers? Do we have wipes? Do we have food for the kids? Is there formula available? Is there somebody to watch the children while mom gets examined or ends up in radiology for a scan? And these are all things that we in healthcare can learn from the hospitality industry in anticipating the real needs of our guests and making them more satisfied with their experience.
I'll tell you one of the best examples of this, one of my favorite ones, is a hotel in Hershey, Pennsylvania, where, as most of our listeners know, there's a theme park. And families are there with small children. Almost all the guests are families with small children. And that hotel actually has a small child-sized check-in desk. So while the parents are checking in at the real front desk, the children are having a wonderful experience checking in on their own at the kids' check-in desk. It's wonderful. And, of course, they get chocolate.
The next thing I'd like to talk about, and let's transition, talk a little bit, and turn a little corner here, and talk about something that's perhaps more operational. I understand in luxury hotels that there is a daily practice by department in different areas of what's called lineup. Tell us about lineup, and why is that done, and what's the benefit of it, Larry?
Well, the lineup has a time-honored history in the hospitality industry, and it happens in independent restaurants instead of hotels. And it originated with maitre d's lining up the waiters and inspecting them, and then talking about the tactical challenges of the day. And that still happens in luxury hotels. Every shift, every department, there is a lineup of some sort. The modern day lineup also addresses basic keys to success and the basic values of the organization, so that people can have examples and hold each other accountable for living out those values. So it's not just posted on a wall, and it's not just talked about occasionally at an all-employee meeting, but it gets talked about every day, and examples are given about how to live out those values to the benefit of all the stakeholders.
One of the things that we can learn in healthcare from the lineup in a luxury hotel is to bring people together to create a dialogue. And it sounds like what you're talking about is that in luxury hotels you talk about the issues for the day, the things that may be coming up. Perhaps there's even a discussion about who's going to be in-house that day. In healthcare, we're learning and we're doing work around bringing the teams together at the change of shift to talk about the things that are most important, the patients that are on the floor, the doctors that may be serving us, to make everyone aware, to answer any questions. The interesting part of those, as I've been involved and actually executed those in hotels, in hospitals, is they're a matter of dialogue. It's not a download. Although I think it could be strengthened by having a good inspection, looking around and saying, okay, do we all look like we're ready to serve our patients today and their family members and the physicians that will be treating patients in our hospital today?
Yeah, and those huddles always take place during shift change times, right, because you're handing off from one shift to another. And one of the things all of our listeners can be aware of, in one instance, we did a study of when most of the accidents occurred in a hospital. And one of the things we found was that most of the accidents were occurring during shift change time, because people are sort of mentally checking out on their way out on the end of the shift, and people haven't quite engaged at the beginning of their shift. And we were able to focus our intent and our resources on preventing accidents at shift change time, and we experienced a dramatic reduction. So some of you might want to look at that while you're trying to figure out how to reduce accidents in your facilities.
Very good. Let's talk about another thing that all of us have noticed that have been in either a luxury hotel or a five-star hotel. It's not hard to notice immediately how absolutely clean everything is and how appropriate and everything is in the right place. You know, that doesn't happen by accident, Larry. How does that occur in luxury hotels?
Well, the two most important things in a luxury hotel are cleanliness and safety and security, and they're never openly spoken about. People don't book a room with a hotel and say, by the way, I want it to be clean. It's an unstated expectation, and it's fundamental. If it isn't there, you'll really notice it. But it must be immaculate. The hotel must be immaculate. It adds so much to somebody's sense of comfort and security when they know the hotel is clean. And it's not just the hotel. When you're thinking about hospitals, what does your parking lot look like? We're talking about the arrival, the importance of the first impression and the arrival. You must go all the way around. In fact, I learned from a Disney executive many years ago that what Disney used to do was called five sensing. When a guest arrives, when a patient arrives, when a family member arrives, what do they see? What do they smell? What do they hear? What is going on with all of the five senses? And cleanliness, of course, is only a part of that. But nothing is more important than cleanliness.
Larry, from a cleanliness standpoint, I noticed that the hotels are very big places, and the housekeepers alone can't be responsible for this. What kind of work do you do internally as a hotelier to get the entire staff involved in keeping the building looking right?
You know, from day one, we teach people it's part of your responsibility, no matter what your job is, to clean up. So you don't step over a piece of paper, just as a for instance. So if you encounter a general manager who's been in a hotel for a few hours and ask him to empty his pockets, there's going to be all kinds of little stuff in the pockets and it should be the case with every single employee. That way, you're constantly keeping the area as clean as it could possibly be.
Larry, what you really taught us from hospitality, or what I've heard, is that it's fundamental. Cleanliness is fundamental, and the second thing is that we're all responsible. Anybody in the healthcare industry needs to be responsible for keeping an area clean, from tidying up a room. Perhaps a phlebotomist comes to draw blood, they need to tidy up the room, or if you find something on the floor, you need to pick it up or report something else. But even more importantly than that is the responsibility of everybody fundamentally joining in to help and creating a sterile environment. As we know, hospital-acquired conditions, hospital-acquired infections, readmission rates are all these things that are important factors, and cleanliness is going to play a big role in improving those. And that's certainly something that we can learn from our partners in the luxury hotel business.
You know, as I mentioned when it came to anticipating needs, unless you have employees who can read the guest and read the situation and feel into what's going on, all the training in the world won't get you excellence there. And cleanliness is the same thing. If you have employees who are bothered by things that aren't clean and things that aren't organized, you don't have to tell them. They will clean up. And when you say this is important, they will do it even better. So, you know, it still comes down to who you hire.
So let's talk a little bit about the experience. We know that in the hotel industry, people show up because they want to, and they come to a luxury hotel with an expectation. Well, not everybody shows up at a hospital because they want to. In fact, I doubt that very many people want to spend a few days in the hospital. Tell us about that control of the experience.
Well, that is one of the differences, I think, between the two industries, because in the hospitality business, the guest controls the experience. They decide when they're going to get up, when they're going to eat, all those kinds of things, what kinds of activities they want to participate in during the day, and how their day is going to go. But that isn't always the case in a hospital setting.
No, absolutely not. In fact, I think, though, that one of the things that we can learn from hospitality from hospitality and healthcare is there may be opportunities to give patients and their family members some chance to take control over their stay. As we know, one of the big issues in healthcare today is transition care, moving people from the hospital to be able to take care of themselves when they go home. So there might be an opportunity when people show up to let them know that when you want your meal, you need to let us know. When your family members are coming, maybe we need to be flexible around hours. Then there might be other opportunities, perhaps taking care of part of their own health care, and some of the needs that they have that they might have been served in other ways. So I think we can learn from the hospitality industry that a more engaged patient may be one that may be more involved.
Perhaps so.
Okay. You know, one of the interesting things about this, as we talked about this previously, and I bring it up now, if someone stayed at a luxury hotel, a very nice luxury hotel area night stay, how much might that cost?
you might spend easily $900, $1,000 a night.
Right. Interestingly enough, if you end up in the ICU for a night, depending on why you're there and the intensity of the care that you're going to receive, that can be up to $3,500 a night. So for that kind of money and the care that's provided, I think that we need to give our guests or our patients every opportunity to take control over their health care and participate in some way.
Gentlemen, I do have a question that's just come in. I'd like to share that with you. It comes from David, and it's about a small, well, I'll just read the question. For a small community hospital, does benchmarking a luxury hotel really make sense?
Yes, I think it does, because luxury is not about the chandeliers and the china and the silver and the what have you. Luxury is about the experience of the patient. And in a small community, the people who show up to that hospital are going to be known to the people who work in that hospital. And so right away, there's a relationship there. Right away, they can use their name. Right away, they can be caring. They can say, Paul, what's going on? And it will be genuine because they're in the community. And it's about the experience, and it's about the relationship between the caregivers and the patients and the families. And I believe a small regional hospital actually has a leg up on creating a luxury experience. And so if they benchmarked a luxury hotel, they'd be able to take a lot back and really augment what's going on there. But they have those established relationships, and nothing is more important than that.
I'm going to add to what Larry said. I think that that's true, David. I think that the issue you really bring up is one of expectations, and you may exist in your organization could be a small community hospital that serves a smaller area or a geographical area. Every one of the people that rises every day and comes to work gets up to come to be their very best, and when you set a very high standard, a standard of great care, a standard of true hospitality to your patients, your physicians, patients' families, to your peers, to others, what you're really doing is you're saying that this is a place that's special. Now, it may not be a luxury hotel, and you certainly don't have a chandelier hanging in the lobby, but the ultimate experience that people have, you want them to be emotionally attached to your brand, and that's what you need to benchmark is how have you won your patients and their family members over to your brand, so when they walk away, they tell people, I just can't even imagine what would happen to us if I did not have the opportunity to be served by this hospital.
And now that you've mentioned that, let me make a remark about high standards. Experiments have shown that employees will live up or down to your expectations. So if you articulate high expectations for your employees, you're more likely to get excellence in performance. And the other thing it does is it shows a great deal of respect for the employees. It says, I believe you can create this kind of excellent experience. So that's extremely important to setting those high standards in both industries.
We have another question from Laura, and she says, so what is luxury for the hotel industry could be equal to quality in the hospital setting? Is that correct?
Laura really asks a very good question, and I think that this really is the crux of the matter is where do these two things compare? And the answer is clearly yes. In a luxury hotel, there are certain expectations that fall within a luxury experience and showing up and getting all the amenities that come along with the value that one would receive. When someone shows up at a hospital, you also expect a quality experience. Now, when you say quality, I'm assuming you may be thinking in terms of measures like core measures, but there are also the satisfaction measures as well, as how courteous were people, how well did they listen, did they explain things in a way that you can understand, was the room clean, did they keep it quiet at night? And this is, from a hospital perspective, this is the luxury or the high watermark for a really excellent experience.
And another aspect of luxury is customizing the experience per person. So we anticipate needs and we ask overtly about needs so that we can create a custom experience for each and every guest so they get what they want, which might not be what the next guest wants. And I think that can be done as well in the healthcare industry.
So I'm going to ask to move to the next slide and really just finish up this section. There's a really very interesting website, as we were talking about, providing control to our patients and having some opportunity for them to control their experience in healthcare. I had been at a baseball game in Oklahoma City, and I, on the scoreboard, flashed mymercy.net, and I went home and brought it up on the computer and looked at it and was immediately impressed. Now, I know that these are the expectations that we'll be following for virtually every healthcare provider in time around meaningful use and electronic medical records and others. But when you look at this, if you look at it in detail, there's a great deal of opportunities for people to email their caregivers, look at their lab results, take a look at their medical history. This really gives people the opportunity to participate in their own care and create a more healthy environment for them and for their families. So as we think about this, these opportunities while people are in the hospital, when they go home, during their transition time, these are all excellent opportunities for us to really hand off some of the power, some of the control to our patients.
We have a really active audience, and we're so excited about that. Star, thank you for sending in this question. How do staffing ratios compare in hospitality and the hospital or healthcare industries?
Oh, my goodness. I'm not sure I know. In a luxury hotel, you might staff one employee for every guest room. But I don't know how that compares to the healthcare industry.
I think I can shed some light on this. The staffing ratios are a hot topic, and it is an important issue, and really understanding this. And a lot of organizations that I work with have begun to look at it in a different way. Instead of looking at ratios in terms of number of, for instance, using nurse to patient, what they're doing is they're taking a deeper dive and looking at it in different ways, like acuity. Who is being participative in their care, who perhaps needs more help. Are there others that can participate? For instance, in a hospital that I worked with, they were enlisting other caregivers to participate at a higher level. So if you worked in PT, if you worked as a lab tech, if you were the RT that was taking care of the respiratory therapist, you were expected to carry out certain tasks that would help the nursing staff and others and participate in someone's care. Others were also being encouraged to do more. Staffing ratios are an interesting thing in healthcare right now, and I think that that's still coming out. I think that when you look at a luxury hotel, having people available to do those things that are necessary and anticipate needs is really what drives that luxury experience, because it's driven on people, and it's talented people that can deliver that care. It's the same thing in a hospital. You have to have people available that can deliver the appropriate care and let people know that they're receiving it.
Let me add one thing that I do know about staffing ratios. I remember I asked a CNO how many nurses she had to staff in the intensive care unit, what was a typical staffing level, and she said, it depends on who's on the shift. If I have certain nurses, I can have fewer of them on that floor, and we'll get even better results and better experience for those patients. And it's the same thing in a hotel. It depends on who you staff on the shift, how many people you need on that shift. Some people just can't work as efficiently and with as high quality as others. So that's something they share in common. It depends on who's on, what the ratio is.
Well, we spent some time talking about what healthcare can learn from hospitality. I think hospitality can learn some things from healthcare as well. So let's take a deeper dive into this. One of the things that we know about healthcare is that we are at a time now where we're collecting a significant amount of information. And one of the things that we collect are around core measures and the value-based purchasing initiatives that include items from the satisfaction items. And we're just collecting a lot of information at this time that is being brought in that we can study. In fact, there are conferences that go on all the time that are called big data conferences because we really have a lot of information and understand a lot about patients. Well, I'd like to give you an example of something I've done working with a client. And working with this client, we talked about their emergency department, and we talked about some of the responses that we were getting, and overall the response to the emergency department wasn't necessarily robust. They were not satisfied with what they had. But after just a few minutes, we took the report apart using Press Ganey. They were a Press Ganey client, and using the InfoEdge tool, we actually produced a report that I call the yes report. And on the graph, you'll notice here that on the yes report, when two things occurred, they ended up in the 97th percentile of the nation, 97th percentile of the Press Ganey database for emergency departments. And the two things that patients had to say yes to was, one, did you receive a discharge call? And the second thing was, were you checked on regularly when you were in the emergency department? Interestingly enough, 55% of their patients responded, yes, yes. They said, yes, we got a discharge call, and yes, we were checked on regularly. If that happened using the same nurses, the same doctors, the same department, the same beds, the same parking lot, the same arrival, all the other things being the same, they were in the 97th percentile. Well, if you just take a look over at the next part of the graph, if they said, no, I did not receive a discharge call, no, nobody checked on me regularly, they ended up in the 1st percentile. And there was a valid sample in both of these. This is what we call a trigger. These are the triggers that are driving performance. And so when someone looks at their overall results and sees that they're in the 17th percentile, generally speaking, don't feel very good about this. One of the things that we learned is that not all the patients feel that way. It is an average overall. There are some patients that are extremely pleased with the care that they receive when certain triggers occur. Larry, tell us a little bit more about this and what hospitality can learn from healthcare in this regard and looking at data.
Well, I think hospitality can get much better at looking at data and really benchmark healthcare industries or healthcare organizations, on this topic. When we do look at data, we have interesting insights. But I think in the hospitality business, people rely on their experience and they say, we know these things without collecting and analyzing data. And one example that occurred in my career is that my company hired J.D. Power to assess the satisfaction levels of meeting planners. And J.D. Power not only assessed the satisfaction levels, but they also assessed what these triggers were, what really made a difference to these meeting planners in saying that they had a terrific experience. And because it was real research and not just opinion, we found some unexpected things. We found that if the general manager of a hotel would spend 5 minutes with the meeting planner, having a cup of coffee or a Coke at the end of the meeting, and just said, tell me about the meeting, give me the good, the bad, and the ugly, that even if they didn't act on it, the satisfaction levels that the meeting planners reported would go up drastically. And so people who acted on that were able to raise their scores, and people who didn't. So that was one of those triggers. But I think in the hospitality business, not enough research is done.
Angela had mentioned another question, and she'd asked, could you please discuss the comparison of the amount of leadership training they receive to deliver the desired customer service relationship?
Well, I'm going to start with this because I have a soft spot in my heart for leadership training, especially in the healthcare environment. And I think that in healthcare we can learn something from hospitality. My experience is listening to Larry and with my peers here in hospitality, luxury hotels look for great leaders that understand their business and run them, and run those departments or run those hotels in a way that make them very high performing and come with a great deal of experience in leadership. My experience in healthcare is that something different occurs, is that the best phlebotomist gets promoted to be the supervisor of the phlebotomists, and the best supervisor of phlebotomists gets promoted to be the best manager of phlebotomists. And what happens is you ultimately raise somebody up that has excellent clinical skills into being perhaps an average or even sometimes below average supervisor or manager. And that's the difference that I see between these two industries. It all starts with great talent, and it's not just talent on the front line, it's talent in the supervisory and management roles. Hospitals need to begin looking at people that may not be the highest clinical performers, but are the people that can engage their staff, to engage their physicians, engage their patients and their family members to create a great experience. Larry?
You know, Paul, I would say more of that happens in the hospitality business than you might think. The high-performing sales manager is promoted on that basis to be the director of sales and marketing, and they might not be a great manager. That happens. And frankly, the amount of training in the hospitality industry is going to vary by company. There are hospitality companies that invest a lot of money in preparing people for leadership positions, and there are others who just walk you over and say, here's your office, and they give you the thumbs up and they say, have a good day, and there's no training at all. So it varies, but there is this tendency to promote somebody into supervision based on their performance as an individual, not realizing that to be a great supervisor requires a completely different set of talents.
All right. Well, let's go on to the next topic. We actually will talk a little bit about demographics, and I talked about the emergency department. But what I want to do now is talk about some specifics around demographics in a different way. And one of the things that we talked about, or that I'd like to talk about a little bit here, is how people in different demographics see the same thing in a different way. Now, what I'd like to do is take a look at the graph, and on the left-hand side, you'll notice that it's labeled from 7 a.m. to 3 p.m. Now, the blue bars are how men perceive the emergency department. The red bar is how women perceive the emergency department. And the combined score is in green. Now, the interesting thing is this is a time of day. It's the same time of day. They're the same rooms, the same doctors, the same rival, the same nurses, the same techs, the same phlebotomists, the same experience occurs. However, men see that experience in the 73rd percentile, while women see it in the 40th percentile. So it's significantly different. There's a difference there. There's a change. It's something that's dramatic. If you look all the way to the right, you'll notice that the night shift is also significantly different. Men see it about pretty average, about the 50th percentile nationwide, where women see it in the bottom 10%. It's the 6th percentile overall. And what you have is the same environment, or the same variables exist, but people perceive them very differently. This is one of the things that we do in healthcare very well, is we take a look at what these things are. We could bring these up by other demographics. We could bring them up by age in different age groups. We could see it in different ways that might affect the type of person that comes in, or if they come in with families and other things, or even based on their acuity level or what their complaint was or how they reported. Larry, how's this? What can hospitality learn from this?
Yeah, I think they can learn to do a better job. This is the same theme of looking at data. The hospitality industry does look at some data, but I don't think they slice it and get as fine-grained a look at that data as the healthcare industry does, and I think it would be very helpful. It's just a question of people in the hospitality industry taking that leap of faith and believing it's worth the investment, that they're going to get findings out of there that are actionable. But I believe they would.
Okay. You know, we've talked about a lot today. We've talked about what healthcare can learn from hospitality, and hospitality can learn from healthcare. I think at the end of the day, what it really comes down to is that great people need to serve our clientele, either whether they're patients or whether they're guests. Larry, tell us a little bit more about what talent means in both industries.
Talent is the potential for excellence. And we're going to put up the gift formula there. In both industries, this is how you can create excellence over time. We have this formula: talent plus fit times investment equals growth. Talent is the potential for excellence. Find out what someone's gifts are, where their aptitudes are, and then think about what is the best fit for someone with those gifts and aptitudes, where their natural spontaneous behaviors are going to lead to success. So if you want cleanliness, you've got to have people who can't stand it if something isn't clean. And their spontaneous behavior then is going to participate in keeping the environment clean. So you determine what the gifts are, you determine what the best fit is, and then you invest in those people. And then when you invest with training and mentoring and practice and giving people assignments that are going to help them stretch and grow, it's going to lead to growth. But an important point for all our listeners to understand is the most important element of investment is relationship. People grow when they are in relationship with the right kind of individuals who want to understand their talent and who want to put them in the best fit and who want to invest in getting to know them. So relationship is the most important part of investment, no matter what else you're doing. And this is going to produce people whose spontaneous behavior produces the outcomes you want, and does it with a great deal of excellence. They remain more engaged. They are less likely to leave the organization. All kinds of things happen. And by the way, back to the leadership training, when you spot leadership potential, those are the people who you should put into your management training program. You should be looking for those people, but not based on their performance in their current job.
Larry, one of the things we hear about a lot in healthcare these days is hardwiring and scripting. And the question I would have for you is, we spend a lot of time into talking about hardwiring and changing behavior and moving satisfaction scores, can't you just hardwire and script cleanliness and friendliness into the staff that you already have?
Well, people are hardwired the way they're hardwired. I don't think it's a good business decision to invest the time and effort and money to change somebody's hardwiring. If you want a certain hardwiring, it's best to select that hardwiring in rather than select anybody and try to change the hardwiring. It's just a better business decision. But can all that stuff, can the scripting improve the performance and the outcomes? Of course it can, but only to a degree. We've all been to a retail establishment where we're interacting with an employee who, God bless her, has just been through the customer training service and knows that she's supposed to smile at everyone, but it's not really a natural behavior for her. So that smile looks extremely artificial. And every time I get that, I say, bless her heart. She's doing what they want her to do. But if it's not genuine, there is a limit to how much improvement you're going to get just from executing the script. And what I found in my career is that scripting is a good place to start. Even highly talented employees like to start from a script, but if they have the talent for excellence, they go beyond the script. Because if I've scripted you what to say and you don't have the natural talent, you can't go beyond that script. You just have to stick to what you've said. The highly talented people will start with the script, but understand that with a given person in a given situation, the script is not adequate, and they will, in fact, choose the right thing to say.
Okay. Larry, thanks. I think that we understand a little bit more about scripting. It's very interesting that you really bring it up from that perspective. And one of the things that really fits in here right now is our patients and I guess our guests really won't remember what we said to them, but they will remember how we made them feel. And when we're acting out of sincerity, when we're acting out of our value system and really care deeply about others, I think that that's the thing that's really going to help create our brand and create our reputation. So let's go ahead and talk a little bit about our research. We know some things at Talent Plus. And Larry, tell us a little bit about long-term client turnover, especially when it has to do with hiring, selecting for talent, and in the hospitality industry.
Well, let me start by saying that when we use the word turnover, for some of our international listeners, the word turnover may mean something different. So I just want to clarify that when we're talking about turnover, we're talking about the percentage of employees who leave the organization. That's the way we're using the word turnover. And selecting the right people and leading and managing them in the right way by the application of that GIFT formula is going to reduce turnover. In other words, it's going to increase retention. And one of the correlations that we have found in all industries is the number one trigger, as my friend Paul would say, to increase retention is the caring of the supervisor. You can script all you want. If the supervisor is not genuinely caring, that's the biggest issue for retaining employees. And you can see on this graph that while the scientific selection of employees and supervisors was not the only thing going on in this organization, I can assure you that it was one of the major root causes of this organization's ability to reduce its turnover over time. And that puts hard dollars on the bottom line.
Well, speaking of hard dollars, let's go ahead and take a look at HCAHPS scores. Now, for our friends in the hospitality industry, HCAHPS stands for Hospital Consumer Assessment of Healthcare Providers and Systems, and this is a system that's used to measure satisfaction in the hospital. There's a series of questions among 10 domains, and some of the questions that are asked are around courtesy and respect, explaining things well, listening carefully, cleanliness. There's just a number, talking about medications, explaining them well, those kinds of things. And this is a graph that really demonstrates that when organizations, and this is a collection of our top clients, when those clients selected for talent and brought great people into the front line, this was noticed by their patients, and their patients actually got better care or perceived better care, and this affected not only the care that their patients got, but it also affected their reimbursement, because reimbursement is a big piece now of the value-based purchasing puzzle.
We do have another question that's come in. This one is from John. If my organization could do one initiative in the next year to make the largest impact, what do you think, or what would you recommend that it would be?
Go ahead, Paul.
I'm going to start with something that we've discussed already. I have found a significant amount of value in working with my clients to identify their triggers. And we talked about this earlier in the emergency department, and that one had triggers that were around being checked on and discharge calls. Other hospitals will be different, other departments will be different, but there are people, there are demographics, there are patients that are reporting best of the best scores within each of your departments. And they follow a pattern. There's something that's happening that's driving them to believe that. It might be a certain nurse that is serving them. It could be the person at the arrival. It could be a series of questions that work together, and organizations need to take the time to dig into that, because while they're trying to fix their entire organization, they need to realize the entire organization or the entire department is not broken. There's areas of their organization they're delivering very, very well to patients in certain demographics under certain conditions. You need to identify what those are, what people feel, what the patients and family members feel about that, and then find a way to continue along those lines. And you know, the staff that you have that work for you today probably have a lot of good ideas about what those are. So if you can identify those triggers and present them back to your staff, you're going to get a lot of great ideas about how to improve overall. Larry?
I don't think I can say it better than that.
Okay. Well, we're gonna wrap up here very shortly, but I do want to share just one thing and ask Larry to talk about it as well. We have the opportunity for to really talk about talent. And when I think about talent in healthcare, I remember one person in particular when I worked at a healthcare organization in Oklahoma City, or in the Oklahoma City metro. And she was a phlebotomist, and she showed up every day at 5 a.m., and I never saw her without a big smile on her face. She was always on time. Her patients loved her. People used to call, or when they knew they were getting their blood drawn, they would ask for her to come and take care of it. This was a person of talent. And when a hard stick would come in the emergency department, they would call her. If she was present, that was a great opportunity for her to show her talent and exercise what that is. Now, some phlebotomists believe that their job is only to show up and draw blood. Lakeisha did not believe that her job was to draw blood. She believed that her job was to show up and make everybody feel good about not only their visit, but actually her visit with them during that time. And Larry, you probably have an opportunity to tell us a little bit about what happens in hospitality, especially around chefs.
Well, yeah, I tend to think of chefs when I think of this because appropriately, the hospitality industry for the last 10 or 15 years has been focusing on improving processes and improving systems, and that's very important. But the importance of talent is this. And the chef example that you asked me for illustrates it for me, is you can put two chefs in the same kitchen using the same equipment, using the same ingredients, and one chef is going to produce a culinary masterpiece, and the other chef is going to produce something that's barely edible. You see this in the music business. Two people singing the same song, the same score. One person is just heavenly to listen to, and the other person you can hardly stand. It isn't just the equipment. It isn't just the processes. It isn't just the recipe. It matters who's cooking the recipe. It matters who's using the equipment as to how good an outcome you're likely to get. So
let's just go ahead and we're going to wrap up and just talk about our takeaways. And I'll run through these, but I think that you can see them. And as we discuss them today, there's some really good points here about what those of us in healthcare with a focus on healthcare can learn from hospitality, and what hospitality can learn and how they can grow from what we do in healthcare. A warm welcome is important, and Larry talked about the 3 steps of service. That knowing your audience and anticipating their needs is really primary to a great hospitality experience, and it's something that we can really do much better in a hospital or healthcare environment. We also know that lineup in hospitality really creates a great environment, prepares people for the day. We need to learn about that in huddles to create a great dialogue in the morning and get people talking to each other, not only about patients and the physicians we'll be serving, but the things that we can be doing to really create a better experience. Our level of cleanliness could probably, if we could model after what we see in luxury hotels, a lot of the things that we do in healthcare would be solved, and we would really have a much better and improved reputation in our communities. I think that if we offer the opportunity for our patients to share in the control of their experience, either through understanding and looking at their medical records, but also participating in their own care, even when they're in our care in the hospitals, that's only going to serve them well as they transition home. And we also learned about big data. And in hospitals and in healthcare, we are measuring a lot of things and understanding more about our patients and their needs. And this is something that our friends in hospitality could learn from us, and really understanding more about how they can serve their customers and their guests to a higher degree and meeting their needs.
Gentlemen, thank you so much today for your time. I think this has been a great discussion. Thank you for all of our participants for sending in your questions and making this a great interactive dialogue. We really appreciate that. I do want to let you know that we will record, and we have recorded this podcast, and we'll be sending out that link so that if there are other people in your organization that were not able to attend today, or we know that some of our guests had to leave early, we can send that out to you. You can feel free to share that podcast with anyone. We'll also post it on our website. That's www.talentplus.com. And as always, if you have any questions or concerns, or just want a little bit more information, or another question comes to you in the middle of the night, please feel free to just pick up the phone and call. You'll get a live person here, and we will find that answer for you. We really appreciate your time today. Larry and Paul, any closing thoughts?
No, we mean it about calling. If anybody wants to talk about any of these things more, just call me. I'll make myself available.
And I agree. I double down on what Larry said. There's nothing more meaningful than a great conversation that brings in the specifics of what's going on in your organization, and we look forward to those. We thrive on it. That is really a sweet spot for us. So pick up the phone, give us a call. Let's have a conversation about the things that are important to you in your organization.
Thank you again so much for joining us today. Have a great day.